Teen pregnancy and childbearing brings substantial social and economic costs through immediate and long-term impact on teen parents and their children. During the month of May, National Teen Pregnancy Prevention Month, the nation turns its attention to teen pregnancy prevention and advances in reducing teen pregnancy. A look at some of the programs is coming up on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio, we have from the Florida Department of Health, we have Jennifer Dickinson, and you are the Senior Community Health Nursing Supervisor.
Correct.
And then you have some alphabet soup behind your name. And then Beverly Dodson is also with us. She's the Registered Nursing Consultant at the Department of Health. So ladies, welcome. Thank you for being here. So we got a lot to talk about. First of all, let's talk Polk County for a second. What are we looking at in terms of a snapshot of what teen pregnancy rates are in our county?
If you look at the data on Florida charts, in 2015 there were 577 babies born to women between the ages of 15 and 19 years old in Polk County. And if you compare that to the previous year, there were 647 babies born to that same age range in 2014. But if you go even further back to 2005, there were actually 1,140 babies born to women.
There's a steady decline.
There is a steady decline, which we are very glad about.
So what are some of the things that the Department of Health is doing, or why does it feel that this is such an important cause message to get across?
Unintended pregnancy causes a myriad of problems, from low birth weight babies to increase in high school dropout rates to high morbidity and mortality in both mother and infants. Preventing pregnancy, unwanted pregnancy, is so vital, especially to that teen population.
Now this may sound kind of like a stupid question, but is it that teens are just not getting that education? I mean, regardless of one's upbringing and beliefs on whether or not they should be having sex, are they just not getting that prevention piece?
I think a lot of barriers to teens receiving that is just the stigma. Nobody wants to talk about it. Perhaps parents are even uncomfortable. But as a parent, we all want to think, of course my teenager is not having sex, but the statistics prove that they are. So we want, as the health department, we want teens to be aware that there's a place that they can come and get counseling, confidential, non-judgmental counseling, treatment, and options that are available to them.
So is that just at any of your health department locations, or is that a specific location?
At all of our sites, our Lakeland, Arbondale, Haines City, as well as our Lake Wells facilities, they offer family planning, STIs, sexually transmitted illnesses, and pregnancy counseling Monday through Friday, 5 days a week.
So that's just, here are your options. Okay, you find yourself pregnant.
Or hopefully they come to us before they get pregnant to stop family, to start a family planning method. We want that message out there to come see us before a pregnancy occurs.
So if there are teens out there that are, playing with the idea of having sex, then they should just show up, ask some questions.
Call and schedule an appointment for counseling.
Okay, so it's a real thing. Like, you could just call and say, hey, what is that appointment called? I can't imagine that being a very easy appointment to be making. Like,
our staff are trained to be very sensitive to minors that may be a little bit embarrassed. But all they'd have to do is call to schedule an appointment. I want to receive a family planning method, or I'm afraid I may have a sexually transmitted disease. We'll get them right into the clinics, very confidential and non-judgmental.
Now, are there any special events or anything going on in the month of May?
We don't have any special events planned, but we have made steps to make all of our clinics more teen-friendly.
Okay.
We are making more appointment times available to accommodate school schedules, as well as the bus schedules, because we know a lot of teens may not have transportation to our sites. We have also tried to incorporate more teen-friendly means, electronic social media, as well as applications and websites that are accredited that they can get information. We know everything that online is not always 100% credible, so we want to make sure that teens have the information that is credible.
Absolutely. I mean, that's half the battle, knowing what is actually factual, what isn't, and where to go and what to do to make sure that if you're going to make a decision that you have all of the necessary things taken care of, the precautions, all that.
Absolutely.
The information.
I think parents don't realize the strong impact that they can make by having these conversations with their teens. It's not something that is comfortable for a lot of parents to talk to their teenagers about, but I think teens need parents they need to understand their feelings. They need to understand what consequences there are if they decide to have sex, how to not have a baby, not to get pregnant, how to protect themselves from sexually transmitted diseases. And they need to have that conversation. A lot of times when these decisions are made, as a parent, you're not there to guide them. Right. You're not there when they make these maybe unhealthy choices. So you want to give them as much information as you can and have these conversations.
Absolutely. I think that health education has come a long way. Obviously, you've got the numbers to back that up. But, I mean, from what I believe it used to be to where we are now, and different contraception methods and things like that, I think there have been leaps and bounds made in terms of education. So I'm sure that has a lot to do with the Department of Health and other education, what's the word I'm looking for, initiatives.
Well, research shows that teenagers who talk to their parents about these things, about sex, about pregnancy, about childbirth and birth control, they actually will begin to have sex at a later age. They will use condoms and birth control more often when they do decide to have sex, and they'll have better communication with their romantic partners. So this is evident in research.
So the research
have these conversations.
Is supporting these awkward conversations.
Yes.
It'll be awkward, but it'll be worth it in the long run.
Exactly.
So these the counseling appointments. So do you ever have teens and parents come to those together? We
always encourage teens to include their parents on any of their decisions. However, we do offer confidential, but we do encourage the teens to involve their parents in their decisions. It's affecting their lives, so of course parents need to be involved in that.
Definitely. So, I mean, it can be bring your parent along. Someone else can lead the awkward conversation. You guys can sit back, or if you are going to make those decisions, at least make that phone call, set up an appointment, and be informed as you move forward.
Absolutely.
So, what else have I not thought of that's very helpful?
Family planning is a key part of preventing unintended pregnancies, including teen pregnancies. But family planning information and education and services also improves birth outcomes, and it also reduces both the impact and the incidence of sexually transmitted diseases through screening and treatment, and improving our birth outcomes and reducing our STD rates are really important issues for the Florida Department of Health.
I probably didn't touch on this earlier, but what is the average age for teen pregnancy?
The Florida charts breaks it down. They usually look at like 15 to 19.
They've got that.
There
okay.
are the other, younger and older than that rates, but those are the main ones that they
Okay.
focus on.
I was recalling in college, when I was in college, that was kind of a long time ago now, but I think the teen pregnancy, like the average age was like 14 in Polk County. And it was, I remember thinking, wow, that's so appalling. Like, at 14, I think I was still making mud pies. Like, I really do. I think I was just not interested. So it is wonderful to see that such progress has been made in terms of that.
Mm-hmm.
Well, ladies, it has been an absolute pleasure having you here, and I certainly wish you luck in your mission, and hopefully we can get the word out to these teens to be responsible and to get them the tools and information they need to be that. So thank you for being here.
Thank you.
The Florida Department of Health in Polk reminds you that National Teen Pregnancy Prevention Month is recognized each May as a time to turn attention to teen pregnancy prevention and the great strides that have been made over the last 20 years. While there have been advances in reducing teen pregnancy, progress is still needed to close racial, ethnic, and geographic disparities in teen birth rates in the United States. For more information, you can check them out on the web at mypolkhealth.org or give them a call at 863-519-7900.